Good evening, everybody. It's so lovely to see you all watching us this evening. My name is Miranda van Dam. I'm the chairperson of the AXPA Association, a support group for patients with AXPA in South Africa. The Voice of the Patient and Experts is a program designed to bring not only live witness, but also to educate and support you at home. Dr. Joyce Ziki is a specialist rheumatologist whose career began in Zimbabwe, where she obtained a degree, completed internship, and community service. In 2012, she obtained her specialist qualifications from the University of the Witwatersrand and the College of Medicine SA. She subsequently joined Tembisa Hospital in South Africa as a specialist physician, from where she returned to Charlotte Mazeki Johannesburg Hospital for further training in rheumatic diseases. In 2018, she qualified as a rheumatologist. She is currently an honorary lecturer at the Department of Rheumatology at the University of the Witwatersrand, where she is pursuing a PhD and is an active member of SARA. Dr. Ziki is competent in the diagnosis and management of various rheumatic diseases. Welcome, Dr. Ziki, this evening to our live stream.
Thank you, Miranda.
Dr. Ziki, I thought we would jump right in. I loved reading the story about where it all started out. And coming from Zimbabwe, studying in Zimbabwe and then moving across to South Africa, that must have been a big difference for you.
It was. And I came to do my specialist training as a physician. And I remember my first post-intake ward round, and things were so different. And the consultant then said to me, my friend, you're not yet ready to be a specialist. You'll have to get more training. But yeah, I mean, at that point I was disappointed, but looking back, I'm grateful because she highlighted my weakness, which gave me an opportunity to learn and then smoothly join my peers as into the specialist training group. So yes, I had to take 6 weeks back and train and settle into the South African system, which is really different from what it was back in Zim. I mean, there are more resources, and as much as people complain about the poor resources and the poor healthcare system, at that point, it was way better from what I had been accustomed to. So it was a challenge, which I rose to, and I managed to acquire the skills needed, and I completed my training as a specialist physician.
That is such a brave journey. I mean, moving from one country and culture to another, it's not an easy thing to do. You were one of the first specialists that I spoke to when we started our association. You're also on our medical board. You are such a supporter of our association. But what I really wanted to ask is, why did you decide to become a rheumatologist?
So it wasn't something I thought of early in my career. While I was still in Zimbabwe, I was interested in HIV medicine. I actually got a diploma in HIV medicine and thought I'd pursue my career in HIV. And I had an immunologist, Professor Sibanda, back in Zimbabwe. He's an immunologist. He's the first person who opened my eyes to immunology, but more on the science side, not the clinical side. And he actually mentored me into an MPhil in cytokines in HIV patients. But I then didn't complete it. And then I decided, you know what, I think I need to study further to be a physician rather than narrow myself into HIV medicine early on in my career. So when the opportunity came to locate to South Africa, I thought, okay, let me go and specialize. And during my specialist training, I had the opportunity to spend 6 weeks in the rheumatology department at Chris Hani Baragwanath Hospital. And I enjoyed myself there. Those 6 weeks went by so fast. And after specialist training, funny enough, after my training, I wanted to become a nephrologist. And when I went to Tembisa and I worked there for 3 years as a physician, then I realized, nephrology patients, at times you can't do much. Once the kidneys are damaged, some patients can't afford to go into dialysis and your hands are tied, especially in the state. And I found that very frustrating. So a year at Tembisa, I decided, you know what, maybe I should pursue rheumatology, because during my specialist training, I'd enjoyed the 6 weeks there. And so I started a rheumatology clinic at Tembisa Hospital. And Professor Ali from Pretoria University helped me start the clinic. He would come out. I mean, he's a very lovely man, He would come out to Tembisa from Pretoria on Fridays, sit with me, and would see patients together. And after some time, I became confident. I could manage a few patients at Tembisa Hospital. And along the way, I decided, you know what, I should go back and train. I wasn't enjoying myself in government. I mean, out in the Tembisa Hospital as a physician. I thought, okay, let me pursue my career as a rheumatologist. And incidentally, at that time, my mom had arthritis, but she was diagnosed as having osteoarthritis. And she had an aortic dissection. Fortunately, she survived. And we never really got to understand what was going on, And fast forward, I got training post at Shalom Matseke. That's where I trained and got my qualification. And at the end of my training, then I thought, okay, my mom was late at that time. And then I realized that probably she had, a seronegative arthritis and likely a spondylo. And maybe that's why she had the dissection as a complication, but she had been diagnosed as osteoarthritis and she was on pain medication and never got onto methotrexate or any of the disease modifying drugs. So partly my mom's disease and the fact that I realized nephrology was not for me, I then ended up pursuing a career in rheumatology. And I'm happy I chose that career. And also, I think it talks to my personality. I enjoy investigating, and that's probably the reason why I went into internal medicine. I want to figure out what's going on, I don't want things that are straightforward, I like mysteries, I like to solve things, and I think rheumatology is a perfect specialty for investigation, figuring out, and being patient. It can take you years to make a diagnosis. And I really enjoy that. And I am enjoying my career as a rheumatologist.
Wow, that is a lovely story. And the connection with your mom is a special one. I can see why, sometimes something pushes you in a direction. That's lovely. I particularly like the part of how you like investigating, because I think we're going to jump into my favorite topic of all time, which is AxSpA. I mean, diagnosing an AxSpA patient is not straightforward at all. I thought we could it takes, as you know, can take patients up to 8 years to get to a diagnosis. And it's a very silent disease. Maybe you can take us through the steps of what leads you to a diagnosis of an AxSpA patient, and why. Maybe we should start off by asking, why is it important for an AxSpA patient to see a rheumatologist?
I think the rheumatologists, so usually, okay, maybe to take a step back, An axial SPA patient is likely to present with backache, okay? And there are many causes for backache. And the axial SPA patient's backache is usually inflammatory, okay? Worse in the morning, that's when the stiffness is worse, but gets better as the day progresses. And at least a rheumatologist tries to tease out the different causes of backache and exclude mechanical backache, and until they try and find their way down to the specific cause of one's backache. So I think that is why it's important that one should see a rheumatologist. But having said that, not all patients with backache should be seen by a rheumatologist. So there are certain red flags or symptoms that should make one think of referring a patient to a rheumatologist. So for example, an inflammatory backache like I described, a backache in someone less than 40, a backache that wakes you up early in the morning, a backache in someone where there's family history of backache or spondyloaxial SPA, someone with an HLA-B27 positive gene, someone with an autoimmune marker that is positive, such as an ANA, you know, one of our screening tests, someone with raised inflammatory markers. And these are things that can be done by the general practitioner, you know, because that is where most patients are going to present to. And once, you know, the red flags are picked up, then refer the patient across, or a trial of anti-inflammatories. And if the patient responds, that's also a feature of an inflammatory backache. So I think a rheumatologist will approach backache broadly and work their way down to a cause, and our area of interest being inflammatory backache. And after that, we then find ourselves diagnosing either axial SPA or backache associated with other forms of spondyloarthritis. So I think it's important that one with the red flags comes and sees a rheumatologist, because we also don't want to find ourselves with all the patients with backache. You know, it's such a non-specific symptom, you know, that if we are to say all backache patients should see a rheumatologist, we'll be overwhelmed. So I think one has to be aware of the red flags, and which can be screened for by the general practitioner.
No,
And
you're right.
you then also find that even then, because of the many causes of backache, finding your way to an inflammatory backache and further down axial SPA can take years. You know, maybe a patient spends 2-3 years with a general practitioner. From there, they are sent to an orthopedic surgeon, biokineticist in between, physiotherapy in between, back to their GP, and then finally to their rheumatologist. And even then, with the rheumatologist, it may also be difficult to make the diagnosis. So it may also take time with the rheumatologist before a specific diagnosis and the correct treatment is started.
Yeah, and you can imagine a patient that arrives at your office after they've been seen from pillar to post. They're not so enthusiastic anymore about taking this drug or that drug because they've now had 50 doctors telling them different things. So there's also that exhaustion of the patient's exhausted by the time they get finally to a rheumatologist, which should be a huge relief. But at the same time, there's that, you're just tired of everybody not giving you any answers.
Yeah, and the story, you know, when a patient with likely, I always want to refer to it as spondyloarthritis in general and not specifically axial SPA. So I tend to use spondylo, but for this discussion, it will mean axial SPA. Okay. So you'll find most of the patients, you know, when they walk in, they either have a plastic or a bag full of x-rays, blood tests. Some patients come in with thick files. They've been filing things over the years, you know. So it tells you of the journey they've gone through, and most of them, yes, the frustration, and they come and they sit and they tell you, look here, this has to be the final end. I need my answers. I was told the rheumatologist is the one person who's going to give me my answers. So I hope by the time I walk out of this door, I've got my answers. And you then have to sit back, relax, and go through all these files and x-rays. And then you end up listening to their stories. But some of the patients, they've got their history laid out, what has happened over the years, whom they've seen. So at times it's a quick history because they've spelled out the process. But yes, they do go through a lot before they get a diagnosis. It's only the few lucky ones, either they've got a clued up GP who's done the genetic marker, so the referral is quick, or someone who's been seen by an orthopedic surgeon who's also realized, no, this is inflammation, and they have an early referral. But the majority of patients, they've been around and they've moved from one specialist to another. They even come from psychiatrists, psychologists, So it talks to the pillar to post, that the patients have to go through. And I can imagine the frustration.
Yeah, I think there's definitely, that's one of the biggest stories of AXPAR patients, is that most of them have, I know hardly of none of our patients that hasn't got a delay in their diagnosis. And it's sad in a lot of ways because somewhere in the system, something is failing, unfortunately. And I guess that's where we need to create awareness of the disease, and we need to not be silent. The disease can be a silent one, but we should be advocating. I think one of the biggest challenges in our country, and I think it's not only in South Africa, I think it's international, is the amount of rheumatologists we have in this country. I'm not really a mathematician, but from my calculations, the maths, it's a crazy thing. It's like 1 to 650,000 people for one rheumatologist. How do you guys cope with this amount of workload? The reality is people are on long wait lists. They have to travel far. Some people don't even have rheumatologists in their provinces. So, that must be a huge challenge for you as a specialist, knowing that there's not really an end.
It is, and I think before I started, I used to hear from one of my senior colleagues that I'm tired, and I just never understood, because you spend your day sitting and you are listening to patients who are in pain, and it's not like cardiology where you say, okay, lie on the bed, you get your echo probe and you say, oh, okay, you've got a valve problem, you need surgery. You need to put things together. You need to find blood results. You need to find what has been done, so it is tiring. So we are few, and the consultations take a lot of time, because you need to put things together. And even in the follow-up visits, there's still a lot of complaints, that you need to address. It's not one thing, it's a lot of issues that you need to address. And because after some time you become the patient's general practitioner, you've known them for so long, they come and see you every 6 months, then you end up managing their hypertension, their thyroid problems, their depression, and you end up knowing these patients. So it takes a lot of time to go through the consultations, and also to decipher information from the history, the notes. So yeah, it can be emotionally draining and physically draining, So from time to time, yes, we need to take a break. And yeah.
You guys are like the angels in the medical world, especially to us patients anyway. So
Thank you.
it was interesting that you said a consultation takes time. Let's say I'm coming to you now for the first time. There's a lot of our patients that are still in a waiting queue to see a rheumatologist. What could they expect going to a rheumatologist, and what should they be preparing anything or make a list, or what are your thoughts on that?
So I think if one can, like I said, write down what has happened, every little symptom that they've noticed, when it started, describe it, it makes the consultation easier, because at least you've got a flow and you've got something to start working with. And it also helps if the patients can bring x-rays, MRI scans, whatever investigations have been done in the past. And now, because of the lab, Lancet Empath, they've got systems where you can get patients' cumulative results. So I tend to get those before the consultation. So at least I've got their blood works as far back as possible. And then after the consultation, I'm just adding on what has already been done. So that I find that makes the consultation quicker, and it helps us get to the bottom of the problem quicker. So I think bringing whatever a patient has and whatever has been done before is really helpful. And you find there are patients who've been on previous treatments, biologics, methotrexate, salazopyrin. Bring that along, keep a history of that. What happened when you're on this drug? What side effect did you have? And then it quickens the consultation and the management of the patient.
I think in what you said lies the message that, yes, I understand you go to a doctor to get a diagnosis, but there's a huge responsibility that lies in the hand of the patient himself. I mean, you can't just go to a rheumatologist and wait for him to say, you have axSpA, here's your medication, and off you run. There's a huge responsibility in a patient to understand their disease, get as much information as they can. As you say, document, keep a paper trail or a diary of what's happening at what point in time, because I think that can bring along the delay in diagnosis, or a doctor getting to a quick decision if you don't really know what happened when. So I think there's a huge responsibility on the patient itself to bring forward that information.
Yes.
So what do you think? What do you think can be done with creating disease awareness? I mean, clearly there's not a lot of disease awareness that needs to be done with the rheumatologists, because they all know what this axSpA business is all about. But I would say that the biggest gaps would be the GPs, physiotherapists, that entry level, even pharmacists. If you carry on going to the same pharmacist for 6 years complaining about backache, surely somewhere there somebody must have raised the flag to say, this, I can't keep on giving you things for your back. You need to maybe go see somebody. So there's a huge arena that needs to be played in.
No, I think you're right. And we should give you credit for this support group. You are raising awareness, supporting those who have been diagnosed, giving them confidence to share the information regarding their diagnosis. And I think that's also very important, the support groups. And like you've mentioned, other healthcare providers besides rheumatologists, because patients don't come directly to a rheumatologist, but bringing awareness to all the support staff, physiotherapists, occupational therapists, biokineticists, like the biokineticists are a big group of specialists who see patients with joint problems, back problems, and if they are aware, then they can direct the patient, in the right direction. So I think that is also very, very important. And even in training, like I said, like I told you, I only got to know about rheumatology when I was training to be a specialist. So if I had stopped my career as a general practitioner, I wouldn't know, I wouldn't know, and I'd be very, very uncomfortable to manage a patient with a rheumatic condition. I wouldn't be able to do that, And I've even had patients, you put them on methotrexate, they go to their GP says, stop, that's poison. And it's because their understanding of methotrexate is it's a cancer drug. It kills, it's got toxic side effects, but because they're also not aware that this drug is very beneficial to patients with rheumatic conditions. So it's not just axial SPA where awareness is required. I think rheumatology as a specialty needs to be taken out there, so that people are aware of this specialty. And even among colleagues, you find someone just says, you know what, I don't know what to do here, take over, Even fellow physicians, they say, no, take over, I don't know what to do. And I completely understand them, because if I had not trained as a rheumatologist, I'd probably do the same. Yeah.
It is a bit like a circle that goes round and round, and somewhere that circle needs to break a little bit. So one of the things that I'm very passionate about is the delay in diagnosis. It would be so wonderful if we could shorten the time, the delay in diagnosis. And I think we've already touched on why in South Africa particularly we have the delay in diagnosis. What do you think from a specialist point of view? What do you think happens to a patient? Maybe we can talk about the emotional side a bit. What happens to a patient when they've been dealing with this long delay in diagnosis? Do you think the emotional side of that, in your experience?
Yeah, so the majority of patients, by the time they come, there's frustration, and they've lost confidence in themselves, There are some patients who after 2-3 visits and they're feeling better and they say to you, thank you, I thought I was going mad, So you can imagine that it was not just the physical pain, but in their mind, society had also begun to think, you're always making up these symptoms. You always have this pain that doesn't seem to go away, So that's the one thing I get, after 3-4 visits, the relief, that at least I'm not making things up. At least there is a name, and, thank you, there is a name that I can put to all these symptoms that I have. And so it talks to that frustration, the hopelessness, and some people even end up with depression, insomnia because they can't sleep, they're ruminating about this problem. And it even goes on to affect their relationships, Like some patients will tell you, I can't even go out with my friends because they think I'm boring. I'm always complaining about pain. So people lose friends, they lose partners, and you find partners come along for consultation just not because they want to support their partner, but they want to get confirmation that she's making up things, there's nothing, she's, and it's, I can imagine, the amount of the toll it takes upon one, and I had a patient who even said, my children just think I'm being funny, but to be honest with you, I'm in pain, and now I have to pretend that I'm okay Because if I tell them that my back is sore or this is sore, they just say, there goes mommy again, but mommy is genuinely in pain. So it does take a lot on one's emotions, and it can sadly lead to depression.
No, that's very true what you're saying there. And I can bear witness to that. When I was diagnosed, I was so relieved. And my second visitation back to the rheumatologist after we started my treatment, I could have kissed her. Come here, hug me, kiss me. You're the best thing that's ever happened in my life. So the relief from diagnosis to treatment can be so spectacular. It can be life-changing. And I think patients, I think the pitfall of the diagnosis is that it's not your life ending, and AXPAR doesn't, it's not all of you, it's only a small part, and you can live a healthy, happy life with this disease. And I think in closing, this is my favorite question. What would be if you could give me a little basket with items in it, excluding medication, of course, let's assume that you are taking the drugs that you're supposed to be taking, or you're listening to your doctor, but what else would you say to your patients that's now been given this huge diagnosis and they now have to go home and live their best normal life? What would be those things that you would say to the patients?
So, I mean, the one thing I always say is, if you take your medication, it's a life changer. And you can be the perfect wife, the happy mother, while you're on treatment. And you don't have to stop. And the second important thing is, besides the treatment, one has to look at their physical health, so exercise, diet, that also plays a huge role, because even in general, obesity, being overweight, worsens joint pains. So addressing those physical needs and exercise is very important over and above, getting the diagnosis. And yeah, so I always say, Puza, take your medication and your life will never be the same.
And you got to now add and join your patient support group.
Oh, yes.
That's the new add-on.
No, that's, like I was saying to you, in the past, you'd find when you tell patients, say, where can I get the information? And I say, just go and Google, there must be support groups out there. And one patient came back and said, I've Googled, I joined one from the States, I think, and it's just doom and gloom. I left the group very fast, So yeah, it's nice that you have such a welcoming and friendly support group that's not going to chase patients away. So yeah, no, I will definitely add that as a parting word. Join the support group.
Dr. Ziki, it's been such a privilege to have some of your time. I know time is so precious to you, and I wanted to just thank you from the bottom of my heart for supporting our association. You're also one of our medical advisors, and I know I can call you at any time if I needed anything pressing and desperate. And it's, any association cannot work in isolation. We would never be able to do what we're doing and love what we're doing unless we actually get the support from the specialists themselves to say, you guys are making a difference. And you're definitely one of your name comes up often, patients, this huge admiration for the work you do. So esteemed and robust, and it's a privilege to have doctors like you in our country that takes our disease seriously and our patients as well. So thank you for being with us this evening and sharing all your little special pieces of knowledge with us.
Thank you, Miranda, and thank you for the opportunity. I mean, it's also very lovely, in as much as yes, we don't have time, but it's also nice when someone calls upon you to help and make a difference. Thank you.
Fantastic. Well, that was wonderful. And I'm sure we'll be chatting soon. And to the listeners at home, this was Dr. Ziki with us this evening. And for all of you that managed to watch the recording, that's wonderful. For all of you that didn't manage to watch the recording, we will be sticking this recording on our website so that you can go back and really listen to what we said this evening. And we will see you soon. Have a wonderful evening.
Thank you.